Postpartum depression is a very common disorder, with 1 in 7 birth givers being diagnosed with postpartum depression. I'm Daniel Costello, and I care about this topic very much because I'm a nurse, and I believe both mental health and mothers are communities that are overlooked in their symptoms and underserved with their diagnoses. Today we will look at what postpartum depression is, why screening is the most effective way to combat postpartum depression, and also treatments for postpartum depression. Postpartum depression is similar to depression in many ways, with there being 3 main categorizations of postpartum depression. First is baby blues, which is defined as just feeling down after birth, not feeling as happy as you should be. The second is intermediate postpartum depression, with that being very similar to regular depression, where you have days where you just feel like you can't do anything, days where you don't want to get out of bed, you don't want to take care of your newborn. And then the third class would be postpartum psychosis, which is categorized as having major hallucinations and thoughts of harm to you or loved ones around you. Many of the signs and symptoms of postpartum depression are similar to regular depression, such as sadness, difficulty sleeping, thoughts of harm, and hopelessness. Postpartum depression has also some very high risk factors, with some of them being high BMI, a family history of difficulty in pregnancy, a history of trauma or abuse in the mother's past, and stressful life events such as loss of job or financial hardship. The number one best way to combat postpartum depression is through screening. There are many approved screening tools that can be used throughout prenatal and postnatal visits with your doctor. These are just questionnaires you fill out, giving you a score to determine your need for treatments after birth. These screenings should be done alone. They should be done based on how you're feeling at the moment, not how you've been feeling or how you think you will feel. They are just to see where you are at the very present time. These scores can determine if you will need therapy or if pharmacological options are recommended for your situation. Next I'll talk about is treatments. Some of the non-pharmacological options are regular talk therapy, where you talk about your thoughts and feelings, the basic therapy you think of whenever you think of therapy. Next would be self-therapy, such as yoga or meditation, where you're just calming yourself down, really just helping yourself without anybody else around. And next would be knowing and avoiding triggers, just like everybody in their everyday life, but you just are more mindful of it. The next treatments to talk about are pharmacological. They are SSRIs and SNRIs, which are basic depression medications that are time-tested and proven to work very well. And recently there has been a new drug specifically for postpartum depression, zuranolone, which is the only drug currently approved for specifically postpartum depression. I hope after this speech you are more informed and more on the lookout for postpartum depression in loved ones and in friends and family, to be able to help and either talk about it or be a shoulder for a loved one to come to if they need. Thank you.